Well, spring is in full swing. That means the flowers are blooming, trees are budding, and for 35 million people in the United States, seasonal allergy symptoms have also arrived. So CNN's Joyce Joseph takes a look at how to determine if that sneezing and sniffling is a cold or in fact an allergy. More importantly, how you can get some relief.
I can't breathe. My nose, it seals up like a door is shut. It's like that. I can't breathe anymore. Constantly sneezing, runny eyes.
Like millions of Americans, Trey Gregory has seasonal allergies, also called seasonal allergic rhinitis or hay fever.
Seasonal allergies are generally allergies to the different pollens. Specifically in the springtime, it's usually the trees, summertime generally the grasses, and fall time generally weeds.
An allergic reaction is the immune system's response to an allergen. Some of the symptoms are runny nose, itchy, watery eyes, and sneezing.
At the peak of suffering from my seasonal allergies, I had to avoid the outdoors pretty much the entire spring. Take the worst head cold you've ever had, remove being tired, and that's it for me, 3 months out of the year, all spring. It was miserable.
Seasonal allergies and colds have similar symptoms, but if your symptoms come on suddenly and occur at the same time every year, chances are you have allergies.
To be sure, you can get tested by an allergy specialist.
There's either skin testing or blood testing. Skin testing entails doing little scratches on either on your arm or on your back, and if you're allergic, it'll get red and itchy and swell up, and you'll know those results within about 10 or 15 minutes.
With blood testing, the lab looks for levels of the antibody called IgE in a patient's blood. Levels are higher in people who have allergies.
There's no way you could essentially prevent allergies. There's ways you could treat it to make it less miserable or to make it tolerable so you can live your life the way you like to live it.
Try to limit your time outside on high pollen count days and especially on days that are very dry or windy. A saline nasal rinse can help clear allergens from your sinuses. For more relief, start with antihistamines. If you need something stronger, your doctor may prescribe steroids. And if you can't avoid your allergens and other medications just don't give you enough relief, allergy shots, also known as immunotherapy, are an option. Trey's allergies were so severe, he chose immunotherapy and it worked for him.
No problem. It's the best thing I ever did to treat my allergies, easily.
Joyce Joseph, CNN, Atlanta.
Allergies can affect anyone at any age, and people with a family history are at greater risk. But it doesn't mean they're going to inherit a particular allergy, just a likelihood of having some kind of allergy. You can log on to the American Academy of Allergy, Asthma, and Immunology at 4aidsandani.org for more information on allergies, as well as a link to pollen and mold levels in your state.
So I'll be running. The first 5-10 minutes isn't bad, but my breathing will get heavier towards like the later part of my workout. And then as it gets heavier and I continue to go, that's when the wheezing sets in and it'll start getting tight, and that's when I know that I need to use my inhaler.
Albert knows all about inhalers. He has suffered from asthma since he was a kid, often having to use his inhaler as many as 4 times a day. The condition eased as he grew older, but returned his freshman year of college, but only during intense workouts.
If I'm doing weightlifting, then I don't really need it. Mostly it's cardio. When I do cardio or play sports or anything like that, that definitely triggers it. As well as if I get sick, if I get a cold.
Albert has what doctors refer to as exercise-induced asthma or exercise-induced bronchoconstriction.
So exercise-induced asthma is when you have asthma-like symptoms such as shortness of the breath, coughing, tightness of the chest, when you exercise or when you exert yourself. A lot of times it's due to the air coming in because you're using your mouth more when you breathe, when you exercise. When you normally breathe, you breathe through your nose, and it's humidified, so it's easier for the lungs to take. When you breathe through your mouth, it's cooler, and the lungs may bronchoconstrict or close up, giving you those symptoms of asthma.
The cold air hitting your lungs is not the only trigger.
Sometimes it could be there with infections, it could be there with pollen, with different allergies, it could be there with cold weather, so it could vary.
Not everyone who suffers from exercise-induced bronchoconstriction has been previously diagnosed with asthma, and symptoms can vary.
So things you should notice if you do have some exercise-induced bronchoconstriction or exercise-induced asthma are shortness of breath, chest tightness, and more than I'm just out of shape. These are more like Your wheezing typically occurs within about 5 to 10, maybe 20 minutes into the exercise. Coughing is big. If you start coughing a lot, that's more than just fatigue. That's probably your lungs are twitching up.
It is a highly treatable condition. Patients are armed with an inhaler and some additional medication if necessary. And there are some best practices for keeping things in check, including making sure you warm up when you exercise.
Motivate each other, come on.
Then Dr. Chacko advises, don't hold back.
We want people going, and we want people going as hard as they can. You know, exercising actually helps the lungs to grow. It's good for you.
Make sure you're breathing. Good job. Good work.
In other words, exercise-induced asthma is not an excuse to skip your next workout.
Let's do this thing!
Michaela Pereira, CNN, New York.
You want food toys or you want cards?
Meet Emma Fabian. She's a spunky 3-year-old who likes to play outside and who likes to paint pictures.
Where's my orange color?
But one thing she doesn't like is peanuts. Why? Because they can cause her harm. Emma has a severe peanut allergy.
They told us to avoid absolutely all peanuts. No peanut oil, no peanut butter, not to cook with it in the house, because even airborne, because her allergy is so severe, it could be dangerous for her. So they just told us to read every single label on every food to make sure there's no peanut in it.
And Emma's not alone. In fact, the number of children with peanut allergies is rising. Over the past 20 years, the numbers have more than tripled. And these allergies are not to be taken lightly and can lead to anaphylaxis, a potentially life-threatening allergic response.
A food allergy is basically when your body sees an allergen and it somewhat attacks it. Your body makes antibodies to that peanut allergen, binds to this peanut allergen, connects, then releases all these chemicals, histamines, prostaglandins, glucotrienes, all these chemicals. Then that causes the symptoms that we see, meaning swelling, hives, nausea, vomiting, and even to the point of loss of blood pressure, unconscious, and the worst part is fatalities or death.
But a recent study published in the New England Journal of Medicine might put a big dent in the number of future peanut allergy sufferers. The study gave one group peanut protein at a very early age, about 3 to 4 months. A second group received the more conventional practice of introducing peanuts later, when a child's about 3. The results were surprising.
They found out they had like an 80% reduction in peanut allergy in the people who had it, who got introduced to peanut early, than those who did not. So that's why it's kind of a game changer on how we're thinking that maybe now we should reintroduce it early versus holding it.
And Dr. Chacko believes that information might also change the guidelines for women who are pregnant or breastfeeding, many of whom had been advised to steer clear of certain foods during this time.
Previously, we recommended breastfeeding women or pregnant women to hold off on eating allergenic foods. But now with this data, I don't think it would be strongly recommended to hold off on it at all, and they likely can eat it without any problems.
And some doctors believe these new advances might be only the beginning in the battle to reduce food allergies.
It probably will go across the board, and it'll probably change. Although we only have the study now for peanut, this will probably change the culture and really introduce allergic foods as early as they're able to, like as with other solids.
What's her name?
Sophie.
And while for now this new insight won't help Emma, current research in the area of food allergies is showing some promise that there might be ways to lower the severity of her reactions in the future.
Why don't you let me push you?
No.
Holly Furfer, CNN.
You may have heard about a new school of thought about preventing peanut allergies in children. Researchers say giving peanut products to infants as young as 4 months appears to reduce their risk of developing peanut allergies. Dr. Thomas Chacko is an allergist here in Atlanta. So, Dr. Thomas Chacko, this is very dramatic in terms of what doctors were telling patients in the past, to stay away from peanuts altogether until a child is, what, 1?
The previous recommendations would be to hold peanuts until about 3.
Wow.
And so now the current study, and this was done for years, decades actually, even with my child who was born in '07, we would hold back the peanuts till after 2 or 3. Most recently, though, a recent study called the LEAP study had shown that they took people with high risk of peanut allergy, meaning people with eczema or egg allergy. And they gave a bunch of children, infants, ages 4 months to 11 months, and they gave one group peanut protein, the other group no peanut protein. And they followed them for months to years, and then they found out the people who got the peanut protein early actually had less allergies. So the take-home was, it's actually better to give the peanut early than to avoid.
And what about pregnant women? That has changed as well. It used to be when your wife was pregnant, you were saying, doctors were saying stay away.
Yeah, so when my wife was pregnant with my first, I told her no peanuts, no tree nuts, no shellfish. And then with our second and third, the data changed, and now it actually looks like giving it early may actually be helpful. So for pregnant women, I say just eat what you want to eat, don't avoid anything.
And talk about peanut desensitization. What is that? Kids who are already allergic to peanuts, they're exposed to it in a controlled area.
Yes, so there's a newer treatment. It's technically called oral immunotherapy or peanut allergy desensitization. What it is an allergist will give you small amounts of peanut protein in flour and then eventually give you full peanuts. It's a way to help people who are already peanut allergic to become desensitized.
But you have to do it obviously in a controlled area.
Oh, yes, this is not to be done at home. No, it's supposed to be done by an allergist, and there is still some controversy and pros and cons, so I would discuss that with your allergist as a potential option for peanut allergies.
All right, Dr. Thomas Chacko, good advice. Thank you.
Thank you.
We found out Chloe had a severe peanut allergy when she was 2. I gave her a peanut butter and jelly sandwich, and she broke out in hives. And a couple weeks later, we took her to the allergist, and they did the skin test and confirmed that she had a severe peanut allergy.
So mostly, when we first learned, it was a little bit of shock and disbelief, just because we had kind of set our minds on how things were going to be, and we had to get used to how things were going to be moving forward.
Well, I think it became a matter of how can we be prepared. So it was about research. It was about always making sure to check every label, to learn a different routine that really helped and just became a normal, natural part of life. Chloe's treatment is epinephrine. If she was ever to have a reaction, we would inject it in her outer thigh. She does not administer it, but I have trained her on how to, so that when she gets older, she'll be prepared. Right now we are doing oral immunotherapy treatment, where she takes a little bit of peanut over a long period of time to desensitize her. And Chloe is really doing great with that. So we have a lot of hope. At our school, we've put together an action plan with the administration and the teacher. Anyone who is responsible for Chloe knows how to use the epinephrine, knows reactions, what to look for, knows how to read the ingredients, and knows exactly what to do. Chloe has a safe treat box in her classroom. So if the teacher is ever unsure of a product or if it is not safe in the classroom, it's full of safe goodies that Chloe can pick out whatever she wants. She also knows that if for some reason a friend wants to give her a piece of candy, something that she can't have, when she gets home, Mommy's gonna make her something even better. We'll get something from the store.
Or I just don't take the piece of candy or whatever it is that my friend gives me.
The most important advice I could give another parent is to always have the epinephrine with them, to make sure your child is included in everything they can be included in, and to make sure that your child is an advocate for themselves. It's really become such a great thing for her because she has become so strong and incredible.
I ate 37 peanuts. And I didn't have a reaction. And peanuts are yummy. And I can have all kinds of treats on Halloween. And I'm having a party on October 1st, so I hope you come.
Today is the first day of spring, and you may already be feeling those springtime allergies. Those beautiful flowers and trees come with pollen that may be doing a number on your sinuses. Allergist Dr. Thomas Chacko joins us. So good to see you.
Thank you for having me,
I bet your offices are packed this time of year. Do you have people coming in looking for some sort of relief?
Yes, now is a very busy time of the year for me.
It really is. And what tips do you have for patients who come in that say, I have allergies, I really don't know what to do?
So first I tell them to watch the pollen counts, because you could follow that and then see how bad the pollen will be, and theoretically then how bad your symptoms will be. I say when the pollen counts are really high, they may want to limit their time outdoors.
Okay.
The other thing I tell them is to use the medicines. One of the best medicines are these saline rinses, the neti pot, these natural saline rinses that'll help move the mucus, move the allergen out, and then help clean your sinus passages.
I heard that the neti pot is excellent. And also antihistamines, they work as well?
Yeah, so there are a lot of now good medications that are over the counter, like the antihistamines, and now actually the nasal steroids as well are over the counter, and those medicines should help with your symptoms.
And there's on Facebook and Pinterest, you see all these kind of natural tips, like eat spoonfuls of local honey, also lavender and humidifiers. Do they work as well?
The answer is there's no data on eating local honey as working. That being said, I do have patients that swear by it. So I tell my patients it should not hurt you and it may help. If you want to go more natural, I would say one of the best natural treatments you could do are those Neomeds or the sinus rinses.
And what about the air purifiers? I've put a couple around my house. Do they work?
The air purifiers may help, but they're not as effective for the pollen. In reality, for the pollen, I would drive with your windows up, keep the windows down at home, and then use the AC.
But you say still stay active. I mean, it's beautiful here in Atlanta. You can go outside.
Oh, I would always recommend going outside, staying active. Just take your medicines, see your doctor, and you should be able to enjoy your spring.
All right, allergist Dr. Thomas Chacko, good to see you. Thanks.
Thank you. First, the parent should be well aware, A. And it probably depends on the kid. I'd have them be aware probably close to 6 or 7, but obviously a 3-year-old, they would never administer it. You'd have to give it their parent. But once they're 5, 6 or 7, have them learn about it, have them learn about using the medicine, but more so have them learn about the triggers. Probably in a 5 or 6 or 7-year-old, the biggest trigger would either be an insect sting or a food allergy, more likely a food allergy. Let them know that they are allergic to these foods and let everyone know that they shouldn't be having these peanuts or they shouldn't be having the tree nuts, and ask when they're given a food, is there anything? Or let parents know that they are food allergic. Most of the kids actually never wind up needing the epinephrine, luckily. They've been avoiding it. So I don't have many kids who have used the epinephrine. All of them are afraid when they have to use it. That's just understood. But I tell them that usually the auto-injectors are much bigger and scarier than the actual needle. The needle is not even that big, but it's just in a big device. But most kids will still probably be afraid, but then you have to explain to them, this is what we need to treat this life-threatening reaction. And then you just give it to them and try to explain that to them. We're much more aware of it now than than in the past. So the death rates are not as high because schools are aware of it and we're able to give treatments. I tell them, talk to the school, try to educate them, talk to the school nurse. Most schools do have epinephrine there, or we're allowed to hold it for your student. Make sure the school nurses know, make sure anyone in the staff knows. Usually there's an action plan that I have the parents give to the schools. A lot of schools will have pre-made action plans, and I just have to fill it out about when to give diphenhydramine or antihistamines. So they'll have these protocols, and so I would just fill them out and tell them to give when to give what, as well as emergency numbers, and typically on the top, like what the kid's allergic to, like peanuts or wasp or whatever, so they're aware of that. So either we have the forms, but I would say most schools or daycares have them as well. Most schools will make it necessary for if your kid has a food allergy or an anaphylactic reaction, they ask you to give them an auto-injector. So I'm often writing auto-injectors for the school or for the daycare. Usually they have pre-filled out paperwork for me that I have to give for them. So now people are more aware of it. So most schools are pretty good about it. The number one thing that you need to know if you're having a life-threatening anaphylactic-like reaction is to make sure you have epinephrine at hand. That is the one life-saving emergency treatment. So that you should make sure you have available and be aware and available and able to use. Speed of which you get the medicine in is probably priority number one. The reason why is because you could have a food allergic reaction and the fatalities occur within minutes. So you really need to get the medicine in you within minutes if it's going to be a bad one. So that's why speed is quick. Like these anaphylactic reactions, the bad ones, happen within minutes, especially insect stings. Minutes, not 30 minutes, not hours, can occur within 5-10 minutes or shorter. Epinephrine works very quickly. It works within minutes. You could see the reaction work within less than 5 minutes, maybe even earlier than that. So that's why epinephrine is the drug of choice, because it reverses things very quickly. Let's say you have an anaphylactic reaction and you don't have treatment. It can be just hives. It could be swelling or angioedema, like swelling of your lips or your tongue. But it could be as bad as I'm passing out hypotension, not enough blood or oxygen to the brain, and then it could be the fatality or death. And that's what those are the ones that we're really scared about. So for life-threatening anaphylaxis, probably the top 3 triggers are food allergies, insect stings, and medications. And it depends, like a drug reaction. And it kind of depends on the age group. Like with younger ones, it's more likely to be food allergies. And in older patients, it's probably more likely to be a drug allergy or an insect allergy. But those are the biggest triggers around. There are some uncommon ones, like you could have latex allergy. Some people even have anaphylaxis to red meat secondary to a tick bite. Again, these are somewhat more uncommon or off the beaten track. And some people even have idiopathic anaphylaxis, where they have anaphylaxis and we don't know the specific trigger. Some people have exercise-induced anaphylaxis, where they're totally fine, and only when they exercise do they have signs and symptoms of the anaphylaxis. So anaphylaxis can be a broad range of triggers. If you have an anaphylactic reaction, you should see an allergist, because they could do some testing or better history to figure out what might have caused that. There's testing to look for different foods, for insects, as well a lot of times in the history. It'll help you to decide what the trigger was. And then there's a good percentage of patients that go to the ER, have an anaphylactic reaction, and a specific trigger is not found. That's actually not uncommon. The difference between allergies and anaphylaxis can be the life-threatening type. Meaning allergies, when people think about it, could be sneezing, hay fever, even asthma. But anaphylaxis could be those symptoms as well as more, including hypotension or low blood pressure, wheezing to the point where you can't breathe, loss of consciousness or passing out. So anaphylaxis is life-threatening or very severe allergies. If it's a food allergy, most people discover that when they're younger, when it's either the first or second time of introduction to, let's say, peanuts or some type of tree nut. Possibly other sources of anaphylaxis, like an insect sting, like, people could be life-threatening allergic to bee stings. That could be later because you might not have been stung by a bee earlier, or it could be your second time that you got stung that you had this significant life-threatening anaphylaxis. So it depends on what you're allergic to. Most of the time, you don't grow out of anaphylaxis. With food allergies, about 20 to 25% of patients may grow out of it. That means the vast majority, 80% or so, will keep it. So most people do not outgrow anaphylactic reactions. I would say the mortality rates are not going up, meaning we are better now at identifying anaphylaxis, and people are much more aware. So people aren't dying as much from anaphylaxis. Unfortunately, there still are deaths, but not as much in the past, because we're better at being aware of it as well as treating it. This is Dr. Chacko with North's pediatric allergist, immunologist, here with About.com to talk about, does your baby have food allergies? Generally, this question come up as new foods are introduced to infants anywhere between ages 4 to 6 months. And it's a question of if the child has true food allergies. The most common food allergies in children are milk and egg. Generally, the reactions are red, itchy, hive-like rashes that occur within minutes of eating the food. Generally, it's seen within the first or second time of ingesting these foods. The 8 foods that cause the vast majority of reactions are egg and milk, wheat, soy, peanuts, tree nuts, fish, and shellfish. If a child does have food allergy, generally the first signs are a red rash, like a hive throughout the body, within the first or second ingestion of these foods, and they generally occur within minutes. If it's not one of the above mentioned foods that I discussed earlier, the probability of a true food allergy is a lot less. Often as infants are introduced to foods such as vegetables or fruits, often they'll get a red rash around their mouth, and the thought is that it's a food allergy. Generally, those are more of a contact dermatitis, as the skin around a baby's mouth is very thin and easy to get rashes. But it's not a true food allergy that would progress to the anaphylaxis where the child can't breathe or have bad nausea or vomiting. If there's any true concern about a food allergy, you should see an allergist because they can get a more thorough history as well as testing and truly confirm if the child does have a true food allergy. For more information, visit about.com. This is Dr. Thomas Chacko, pediatric and adult allergist and immunologist with Northside Allergy, here with About.com to discuss safety tips for children with food allergies. First, let the school or daycare be aware of the child's food allergies. Most daycares and schools have forms that need to be filled out, so they are aware and they have set protocols. Second, be aware that the school, the home, or other significant caregivers should have an epinephrine injector available, as well as Benadryl, should an accidental ingestion and severe reaction occur. Lastly, every child should have a food allergy action plan. This is a personalized action plan including a list of their allergies, signs and symptoms that the child might experience during an allergic reaction, as well as appropriate treatment instructions and emergency contact information. This should be regularly updated for any changes in the child's allergies or possible changes in medication doses. Also, you may want to give your child a medical alert bracelet. This will both let the child know, as well as people around them and different caregivers, the seriousness of the child's food allergies and what foods to avoid. And lastly, there are always resources to go to learn about food allergies and active support networks. One good source is the Food Allergy and Anaphylaxis Network, or FAN, and you go to their website to learn about different resources. These are just some safety tips for children with food allergies. For more information, visit About.com. Hi, I'm Dr. Thomas Chacko, pediatric and adult allergist and immunologist, here with About.com to talk about teaching children about food allergies. It's up to the parents and doctors to explain to the child about food allergies so they're aware of them and know what to do and if they ingest it and how to avoid these foods. First, you have to talk to the child in an age-appropriate manner. They might not understand the word allergy, but you have to tell them that these foods may make them feel icky, or may make them have a stomachache or have a rash, and therefore these foods can cause them problems. Number 2, they should always know to ask about different foods and if they contain the things that they may be allergic to, such as eggs or peanuts. The child should know that if they're giving snack time, they should ask if there are any nuts in those snacks. You should empower them and let them feel that it's appropriate to ask different people about what's in each of the foods. Also, you may want to give your child a medical alert bracelet. This will both let the child know, as well as people around them and different caregivers, the seriousness of the child's food allergies and what foods to avoid. Let the child know that if eating a food and they have a funny feeling, that it's okay to spit it out. And if they have any itchy, funny feeling, they should spit it out and then tell an adult. And lastly, there are plenty of books geared for children with food allergies, telling them about food allergies and what may happen and what they should do. And you should read that with the children so then the child can relate and feel empowered. This is Dr. Chacko, and for more information, visit About.com. My name is Dr. Thomas Chacko. I'm a pediatric and adult allergist immunologist, here with About.com to talk to you about tips for dealing with multiple food allergies. First, you might want to confirm if you truly have these allergies. Often patients with allergies can have them as a child but outgrow them in their middle school or adult life. Most children outgrow milk and egg allergies, whereas peanut, nuts, shellfish, and fish tend to persist. You want to get reevaluated and retested to see if you truly are allergic to these foods. Once confirmed, you can work with your allergist about different resources or alternatives to the foods you may be allergic to. It is important to read labels to make sure no allergy-provoking ingredients are in the foods you may be eating. There are resources like the Food Allergy and Anaphylaxis website, or FAAN, and that gives you different recipes in which you can substitute allergy-producing foods with other things. For example, there are recipes where you can make muffins or cake without eggs and use other substitutes. Also, eating out can be difficult, so generally you want to stick with restaurants you know that are very safe for food allergic patients. Lastly, you want to make sure you always have emergency treatment with you, like liquid Benadryl or an epinephrine injector at all times in case of an accidental ingestion. Having multiple food allergies can be challenging, but generally, with some trial and error of recipes in different restaurants, patients can find ways to still enjoy and even eat out safely. Thanks for watching. For more information, visit about.com. My name is Dr. Thomas Chacko from Northside Allergy. I'm a pediatric and adult allergist immunologist here for About.com to talk about hosting safe allergy-free parties. First thing you want to do is make sure if any of your guests have any allergies. Make sure it's known and ask everyone if they have any allergies and what they might be. For example, if you're having a guest that is allergic to peanuts, you may not want to serve Thai peanut chicken because then they won't be able to partake in those foods. Number two, I'd also let the guests know what other guests are allergic to. For example, often you bring in other dishes or you may bring a dessert, and if someone's allergic to egg, then they can't participate in that cake or that custard. So let the other guests know what food allergies might be there with the people attending the party. And you want to make sure you avoid any cross-contamination. Make sure to separate dishes based on what allergies someone may have. For example, if there's a custard in the desserts which have a lot of egg in it, you want to keep it away from the other desserts so that it will not cross-contaminate with any of the other desserts. And also use the same utensils per dish. You don't want to take one spoon and then put it in another and then cross-contaminate any of the foods. Lastly, you might want to put signs on the food to let your guests know what's in the food, because often they might not know if it does have any nuts or peanuts or eggs. So label the foods and that'll make it good. Thanks for watching. For more information, visit About.com. This is Dr. Chacko, pediatric allergist, discussing skin testing for food allergies. Generally, the prick testing for food allergies is a very simple test in which we do a small scratch on the back or on the leg on different areas, and we dip the tip of the prick in different allergens, such as peanut or egg or milk, and we scratch the child, and then we wait 10 to 15 minutes, and if the child is allergic, it'll get red and itchy and swell up within 10 minutes. It's generally very painless, and the results are known within minutes. Based on how big the wheel is, we can determine how sensitive a person may be to a certain food. Another way you can test for food allergies is by blood testing. The two methods are generally either scratch testing with a prick or the blood testing. Both are very good, and both have good reproducibility in determining if someone has sensitivities to food allergies. One is not necessarily more accurate than the other. The skin testing is quicker and probably less painful. I often will consider doing the blood testing if the child has bad eczema or there's no areas to do the scratch testing, in which the skin, you cannot get an accurate prick testing. For more information, visit About.com. Hi, I'm Dr. Thomas Chacko, pediatric and adult allergist immunologist, here with About.com to discuss when you should seek medical help for food allergies. If you suspect that you or your child have food allergies, really at that point you should discuss this with your doctor. By listening to the history as well as doing confirmatory testing, either by scratch testing or by blood testing, your allergist can tell you if you're truly having a food allergy or versus an intolerance. Generally, an allergic reaction to a food occurs within minutes of eating the food, but it can occur within hours. The first sign in 90% of the people with food allergic reactions is the rash. It's generally considered urticaria or hive-like that goes throughout the body. As it gets more severe, patients can have nausea or vomiting as they're trying to get rid of the food that they're allergic to, or even severe stomach cramping or diarrhea. Patients can have asthma-like attacks to this food in which their lungs spasm up and they can't breathe. And lastly, and more seriously, they can have dizziness or lightheadedness and even lose consciousness or pass out because they become hypotensive, or there's no blood perfusion to the rest of their body, including their brain. And that's a very severe allergic reaction to a food. Often food allergies are found at infancy, anywhere between 1 and 2 years of age, but they can present even in adulthood. Really, if you do suspect that you have a food allergy, you should see your doctor, because testing can help confirm it. Testing and the history can help confirm it, and if you do have a true food allergy, you should have emergency treatment at hand, which includes the epinephrine injector as well as Benadryl. For more information, visit about.com. The weather's nice and you're going to want to be outside. But with that, the bugs are also going to want to be outside. Here are some tips to protect yourself from some of the insect bites. So the areas that you're most likely to get bug bites or stings are in the picnic area from fire ants. The other areas are wooded or dead trees because bees and wasps like to stay there. Also under eaves or under awnings because wasps make their nests there. Certain bugs and insects like the picnic tables because they like the smell of food. Sweet smells, bees and fire ants are attracted to. Often juices or soda cans are where you may find bee stings. So you have to be careful with anywhere that has liquid or sweet smells. So areas where ants like to make their home are in the grounds. So you'll see little anthills or mounds where ants may be found. Areas where you'll find hornets or wasps or sometimes even bees are inside of trunks, dead trees, shrubbery like this. So this area might be where you have to worry about certain type of bees. So if you do get bit, things that you consider doing to try to reduce the reaction are A, putting a cold compress to keep the swelling down. B, make sure you wash it because you don't want it to get super infected. And C, you could then use some topical anti-inflammatories like hydrocortisone or topical anti-itch creams to help decrease the symptoms. If you do get bit and the stinging and the inflammation are painful, you can use anti-inflammatories such as ibuprofen to decrease some of the discomfort. So if you're allergic to bees and you have that life-threatening type of reaction in which you have diffuse rash or hives, shortness of breath, nausea and vomiting, those are serious and you have to take it with precaution. Those patients should make sure they see an allergist and have an epinephrine injector with them at any time when they're outside and at risk for getting insect stings.
Gardening in the springtime doesn't sound fun. I know I'm not going to breathe. My eyes are going to be itchy, so it doesn't sound like a fun experience at all.
So Bruce, even with your allergies, we can have you still garden. The first thing you're going to want to do is make sure you wear some long clothing, long sleeves, long pants, and gloves to make sure you keep yourself away from the pollen. So gardening with allergies, I'd make sure that you look at the pollen count and make sure it's the days that you plan to garden, the pollen counts are not exceptionally high. I would also make sure to take off your clothes after you garden to not bring the pollen inside. I wouldn't plant any plants outside windows because that could bring the pollen inside your house. I would also make sure you take your allergy medicine before you garden to help protect you from any type of allergic reactions. Also, pollen counts tend to be higher in the mornings around 10 a.m. to 12 a.m. So I'd probably plan to garden sometime after that in the later evening. You don't want to go gardening on a windy day because the windy day will then increase the pollen count, so dry days are better.
So coming with spring, flowers make me nervous, should they?
Actually, these colored flowers really don't produce a lot of pollen that bother people. It's really the trees, so I would not be worried about planting any of these type of flowers.
So when I mow, my grass allergies absolutely kill me. Is there anything I can do to help with that?
If you're known to have bad grass allergies, I would make sure you take your antihistamine prior to mowing. You should probably use about an hour to an hour and a half prior to mowing. If you know you have bad grass allergies, make sure you use a mask. Lastly, if you really use the mask and you have the pills and you're still having problems, then I might actually get someone else to do your mowing.
Someone else has to do my mowing. I think I can live with that.
So before exercising outside in the springtime, there are a few things you should check. One is the pollen count. You want to make sure the pollen counts are not exceptionally high, like in the hundreds or thousands. You want to see the weather and see what the wind levels are. When there are higher winds, the pollens get up more in the air, and then you breathe it in and have more problems. So you want to go on a less windy day. It's also better to go outside after the rain. The rain keeps the pollens down versus dry days when the pollens are up higher in the air. Make sure to take your medicines. It takes about 30 minutes to an hour for the antihistamines to work, so I would take that appropriately in time. The second thing is a lot of people with allergies will also have asthma, so their lungs will be constricted. Make sure you take your asthma medicine, your albuterol, about 20-30 minutes before you go out for your run. And when you come home, make sure to take off your clothes because there'll be pollen on your clothes, as well as to wash your hair and shower off because there'll be pollen on your hair. Sometimes the pollens get astronomically high, like in the thousands. And even those people without allergies can get symptoms at that time. At that time, A, you may want to stay indoors a little bit more, or B, take your medicines, take your antihistamines. Some patients, even when the pollen counts are low, will still have bad symptoms if they're very sensitive. So it's a combination of your sensitivity as well as the pollen counts. My take home that I want you to know are people with bad allergies should always exercise. Their allergies should not stop them from exercising. Exercising actually helps open the lungs and helps people with asthma get better. So we never want to prevent the exercising. They're great treatments to help with that. After you do all those precautions and you use the antihistamines and the nasal sprays and you're still doing poorly, make sure you see a doctor. So it's very good treatments to try to help you with your allergies. If your allergies are not responding to the traditional medicines or you don't like them, there's something called allergy immunotherapy or allergy shots that help you to cure you of your allergies. And that's often a treatment that'll help significantly with bad springtime pollens.
Happening right now, Metro Atlanta is under a smog alert. Here's a live look outside. It is hot out there. State officials say so far this year we've had 13 alert days. And today we learned why we're seeing more warnings about unhealthy air conditions. Even when you don't see a problem in Atlanta's blue summer sky, pollution from exhaust pipes and ozone is adding up to health concerns for some people this summer.
Asthmatics, anyone with COPD or any lung issues in general, where their lungs are a little more brittle than the average person, should be aware of ozone or anything that could irritate their lungs.
Dr. Thomas Chacko with Northside Allergy and Asthma tells patients to watch for breathing trouble.
There are more ER visits for asthma attacks when the ozone's high, so you have to be careful of that.
There's a code orange smog alert.
Meteorologist Karen Minton has had more smog alert forecasts to share this season for a couple of reasons. Environmental officials lowered the threshold for how much ozone and pollution triggers an alert. Plus, although experts say in the bigger picture Atlanta's air quality is getting better, recent hot, dry air is pushing more days into the orange zone, which can be a problem for those asthma patients. At red, more people might get a cough or feel some throat irritation. But the vast majority of us, Dr. Chacko says,
I want you to go out, enjoy the summer, go to the pool, exercise. So if you're healthy, I'd be aware of it, but otherwise wouldn't limit your activity.
Continuamos con más aquí en Noticiero Telemundo Atlanta. Gracias por hacer de esta su primera opción para informarse. Y bueno, aunque el primer día de primavera será este viernes, ya llegó el polen. Y hoy María Duarte nos habla sobre cómo disminuir sus efectos y así podamos disfrutar un poco mejor de esta temporada.
Entre lo bonito de la primavera también está algo poco agradable, el polen. Pero gracias a avances en la medicina, la primavera no tiene que ser una pesadilla.
Otra vez.
Así como la que ha vivido Wilfredo Mena por más de una década.
La primavera sí es horrible. A veces no puedo ni respirar. Se pone bien fuerte la alergia.
Wilfredo es una de las más de 40 millones de personas en los Estados Unidos que sufren de alergias y su amplia variedad de síntomas.
Alergias puede dar tos y congestión y líquido de la nariz, también agua de los ojos.
Además, picazón en el cuerpo, como lo siente Wilfredo y le impide hacer cosas simples como pasar tiempo con su familia.
Poder estar afuera es algunas cosas que a veces no lo puedo hacer ni con mi familia. Salgo afuera y a ratito ya estoy que no puedo aguantar, entonces me tengo que entrar para adentro.
Un alto índice de polen se considera cuando sobrepasa los 1.500 partículas por metro cúbico. En Georgia, el índice ha sobrepasado 9.000 por metro cúbico. La temporada más fuerte es de mediados de marzo hasta principios de mayo. El doctor Chacko dice que, aunque es imposible prevenir las alergias, sí existen maneras de disminuir sus efectos.
Cuando el polen es muy alta, debe que quedar en la casa más, no debe que jugar afuera.
Cuando es necesario salir, al regresar se debe cambiar de ropa o bañarse para quitarse el polen que lleva en su piel o cabello. Cuando esté en su casa o en su coche, mantenga sus ventanas cerradas. Además, se recomienda el uso de antihistamínicos o esteroides nasales para sus síntomas. Pero si sufre de alergias crónicas como Wilfredo, existe una nueva opción.
Hay inyecciones pues casi curar las alergias.
8 meses inyectándome, se ha ido mejorando, pero como es un transcurso del año entero, con el tiempo esperemos que no tenga que sufrir tanto.
Para aprender más sobre cómo tratar las alergias, puede visitar redalergiayasma.org. Ahí podrá encontrar información y recursos en español. Reportando para Noticiero Telemundo Atlanta, María Duarte.
Sintoniza Telemundo Atlanta por Antena Digital, Comcast, Dish y por AT&T Ubers.
Gracias, Randy, por tu reporte. Y con la llegada del otoño a la vuelta de la esquina, nos preparamos para temperaturas más frescas, festivales para celebrar la nueva estación y el cambio en color y caída de las hojas. Pero ¿sabía usted que durante las próximas 2 semanas habrá un incremento de personas buscando atención médica por problemas de asma y de alergias? María Duarte al respecto nos tiene más detalles.
Alergias puede dar tos y congestión y líquido de la nariz, también agua de los ojos.
Estas son las síntomas que sienten las más de 40 millones de personas en los Estados Unidos que sufren de alergias. Aunque muchos asocian las alergias con la primavera, el otoño también trae un brote de un tipo de polen, la ambrosía, o en inglés, ragweed.
Ragweed viene en septiembre y octubre, viene a la más alta el fin de septiembre.
Este tiempo también se relaciona con la gripe y sus síntomas pueden ser similares a los de la alergia. Pero sí hay maneras de distinguir entre ambos.
Con alergias tiene tos, tiene líquido claro, no oscuro. Depende cuando tiene estos síntomas. Si hay tiempo cuando tiene mucho polen alto, puede ser alergias.
Y para los que sufren de asma, las consecuencias de las alergias son más severas, ya que el 60% de los ataques asmáticos se pueden atribuir a una alergia. Y ya que los niños son más proclives a tener asma que adultos, es importante que los padres estén al tanto de que el niño tome sus medicamentos y también seguir ciertas precauciones.
Cuando el polen es muy alta, debe que quedar en la casa más, no debe que jugar afuera.
Y cuando es necesario salir, al entrar se debe cambiar de ropa o preferiblemente bañarse para quitarse el polen que lleva en su piel o cabello. Expertos dicen que es casi imposible prevenir las alergias, pero sí hay maneras de tratarlas con antihistamínicos o esteroides nasales. Y para quienes sufren de alergias crónicas, existe otra opción.
Hay inyecciones pues casi curar las alergias.
Y para aprender más sobre cómo tratar el asma o las alergias, puede visitar redalergiayasma.org. Ahí podrá encontrar información y recursos en español. Soy María Duarte, reportando para Noticiero Telemundo Atlanta.
Sintoniza Telemundo Atlanta por Antena Digital, Comcast, Dish y por AT&T Ubers.
So I decided to become an allergist because I like the fact that I can take care of families. Allergies tend to run in the family, so if the parent has, the kids will have it. Allergies, asthma, sinus disease go together, so I get to know them pretty well, and you get people better. I think my practice is unique from some of the other practices because I'm the only allergist, immunologist in the group. Some of the bigger groups you see a few different doctors, and it's just a bigger system. I'd like to say, even though I'm pretty busy, I'm more like a mom and pop shop, that you see the same doctor. I try to give patients as much individual care as possible. I try to be as accessible as possible. I also think it is an advantage that I do work with ENTs because they get the best. The patients, especially with bad sinus disease, bad upper airway disease, gets the best specialists in both worlds. My philosophy for treating patients is treat patients and people like you would want to be treated. That's my main goal. I try to do my best to get them better, to get them happier, and I try my best to be as accessible for patients. Want to make sure that we're up to date with the most current knowledge, the best treatments, as well as the best doctor and the best staff.